Hey, hello everyone. I think that we are live. Yes. Okay, if you are watching in YouTube or if you're watching on Facebook, could you please just drop me a comment to say hello and that you can hear me? That would be really helpful. Thank you so much. Just to make sure that I can see everyone and hear everyone. We've got our third webinar today with Medics and me, and they're going over the ethics of medicine. Kelly and Amy are going to be doing the session today. Like I said, this is the third one. So if you missed any after this, you can go back and watch them on our YouTube channel. If you have any questions as we're going through, pop them in the comments and I'm going to feed them through to Kelly and Amy and they will answer them to the best of their ability. I'm getting some comments saying that you can hear me. Excellent. Thank you very much. Okay, fab. Well, without further ado, I'm going to pass you over to the guys. And thank you very much.
Perfect, thank you. So hi everyone. As we were introduced, I'm Kelly and that's Amy, if you can see her. And we are part of the events team for Medics and Me, and this is our third interview, third talk of our interview series. So if you haven't been to any of the other two, make sure you have a look at the recordings or check us out on Instagram or our website as well, so you can get all the information on there. So this session in particular is about ethics and role play and your ethics and role play stations that may come up in interviews. If I could have the next slide, please.
Yeah, one sec, sorry.
Thank you. So why is ethics important in medicine? So medical ethics scenarios are common in a lot of medical interviews, from MMIs to panel interviews. They're very, very common. The interviewers use these questions and scenarios as a valuable tool to assess your logical reasoning skills and also testing your understanding of essential medical ethical topics. They're an essential part of understanding some of the possible challenges that you will face in your life as a medical student and also further down the line as a doctor. It ensures that doctors provide high quality care to their patients and fosters that trust between healthcare providers and their patients, and maintaining that integrity and professionalism of the medical profession. It's really important that you are familiar with these concepts, because ultimately they'll guide your clinical practice for the rest of your career. So I think a couple of those points that I've spoken through are going to come up now, if you want to click. Yeah, so that's the ones I've spoken through. So it's a really important aspect of medicine to get your head around, because no matter what you do and no matter what healthcare career you go into, but specifically as a doctor, you'll be facing these ethical dilemmas consistently throughout your practice. So it's a good one to get your head around. So we're going to first go through the 4 pillars of medical ethics. So the 4 pillars of medical ethics are autonomy, beneficence, non-maleficence, and justice. The timing's perfect. So these act as an ethical framework for you to reason through any ethical scenario. So I'm sure some of you might have heard of these, but if you haven't, we're going to go through them. So autonomy, if we go through the first one, is the notion that a patient has the ultimate decision-making responsibility for their own treatment. In order for this to be met, a patient must be fully informed and of their treatment options so they can come to their own decisions. So patient care in the UK is patient-centred, and they're essential part of the decision-making process. So it's not something to dispute. It's important to consider a patient holistically as a whole and help them to come to the right decisions for themselves, remaining non-judgmental, and ensure their right to make a decision as long as they have capacity, which is something that we'll go through later on. So that means that people have the right to make unwise decisions. So even if yourself as a doctor or as a person don't agree with what they're saying, as long as they have autonomy, they have capacity, then that's the final decision, regardless of your view as a doctor. So if we go on to the next one, in terms of beneficence, you're asking yourself, what is the best thing you can do in this situation? It's a process of ordering the treatment options from best to worst and considering all of the implications of your decision. It's often simplified to the phrase do good, but it's a bit more complex than that. It involves optimizing the benefits of medical care for a patient. Doctors must advocate for the course of action they believe will serve the patient's best interests. So that goes again to the point that I've just made that, for example, some religions don't agree with blood transfusions and that sort of thing. So very complex with this. Do good makes it sound very simple, but there are lots of complex scenarios in which it can be applied. So, for example, if you treat someone for a condition, but in doing so, you might make another condition worse, another treatment might have a better outcome for the patient. Therefore, the most beneficent thing to do is to do the less effective treatment, but with the overall outcome for the patient being better. So, if you were to amputate a patient's leg, the pain following the operation and reduce mobility for that person may still be the best option if the leg remaining attached to their body would result in them passing away, if that makes sense. If any questions at all, please just pop them in the chat. Beneficence is also about ensuring that your actions are in line with patients' expectations and ensuring that the solutions are proportionate to the problem. The best outcome may not be achieved through extensive treatment if that's not required. It's important because it ensures that healthcare professionals consider individual circumstances and remember that what is good for one patient may not necessarily be good for another. So it's taking each scenario and putting into context the patient as a whole. So if we move on to non-maleficence, this goes hand in hand with beneficence, and the two are often considered sort of inseparable. It means to do no harm or allow harm to be caused to a patient through neglect. When practicing non-maleficence, you remove the options of treatment which will incur more harm than good. So you need to look at what risks are associated with which intervention, including non-physical risks to a patient, meaning that you have to ensure that they're being treated with respect and dignity, and that you know your own capabilities, not offering something which you should not. So you may be wondering, how are the two different? So they differ in two key ways. Non-maleficence functions as a threshold for treatment, meaning that if a treatment's potential harm outweighs its benefits, it should be excluded from consideration. This is in contrast to beneficence, where we consider all valid treatment options and then rank them in order of preference. And then secondly, we normally apply beneficence to specific situations, such as coming up with a viable treatment plan for a patient, whereas non-maleficence is a constant principle in clinical practice. And then the last one of the four is justice. So justice is about checking if a decision is in line with the law and the patient's rights. It's about whether the ethical and moral decisions fit into the legal framework. So it's also about making sure that the bigger healthcare decisions are fair and the wider impact in society in an effort to reduce healthcare inequalities across the nation. I don't know about Amy, I'm sure she'll tell you later, but I found this one the most difficult to apply to a sort of ethical scenario situation, but we'll go through obviously scenarios of how you can do so later. Justice is especially relevant to the NHS, which is committed to healthcare for all. Under this principle, it is important that no one is disadvantaged in access to healthcare. As well as looking at the fairness of the action and the legality, it must be considered whether one group is being prioritised over another, and if so, if there is justification for this to happen. So next, we're going to be talking about some theories. So a lot of these are also just a lot of words. So don't get yourself bogged down with the words. And I'm sure you definitely don't have to mention these exact words in your interview. So please don't get stressed, because I'm going to struggle to pronounce them. But we're going to be talking about some important theories which you can pull into your ethical question answers. For example, in an interview, you may have to rank those whom you would save in the event of like an explosion or a catastrophic event. And these theories can help you explain your decisions. In these situations, you can use other tools, but these are some good examples and show you've researched. This is kind of just to summarize, and like I said, please don't get bogged down by this at all. So the first point is deontology. This is the idea that morality depends on rules, duties, and obligations. It suggests the morality of an action, but does not depend on the consequence. But by that following the rules, the action is sufficiently moral. However, in medicine, the point is more that the outcomes may not always justify the means, meaning that care should remain patient-centered and treatment should not just look at the outcomes, but the process of the treatment. Then we have consequentialism, is a theory that morality depends on the outcomes. In other words, the ends justifies the means. This looks at their possible outcomes and their value and the probability of each occurring. So medical law exists at the intersection between consequentialism and deontology. And so understanding both is quite important. We strive to get the best outcome for patients, but through a process which is fair, moral, and in line with the doctor's duty of care. Finally, there is the theory of utilitarianism. This is the idea that what the best increase in benefit on a broad scale leads to the best outcome. It often takes the wider society as a whole into consideration and is a form of consent. I'm going to try that again. Consequentialism. One example of this theory is being used by NICE, which is the National Institute for Care and Health, for Health and Care Excellence, if you haven't heard of it, which is a really important organisation. They have to use utilitarianism to determine the best allocation of funding for different drugs, as there is a finite amount of money available. And so the greatest good for the greatest number of people has to be quantified. One way which can describe this is something called QALYs, which are quality adjusted life years, which NICE uses a £20,000 to £30,000 a year threshold for. Treatments which come in at below the threshold are usually approved, whereas others may be more controversial. As if you pay a lot more for one drug for only one extra quality of life year, it may be unfairly removing the funding somewhere from elsewhere in the NHS. So what are the 3 C's? So the 3 C's in medical ethics are capacity, consent, and confidentiality. So we'll be going through these right now. So consent refers to the patient agreeing to their treatment, and capacity is the ability to give consent, which may be voluntary and informed and can be either written or verbal. Simply speaking, this is whether someone is able to make their own decision. So the Mental Capacity Act 2005 states that the patients over 18 and over are assumed to have capacity as long as they have the ability to understand the information, retain the information, weigh up the advantages and disadvantages, and communicate their decision. So it's worth noting that as capacity is specific to each decision, a patient could have the capacity to make a certain decision, but not another. And moving on to confidentiality. Confidentiality is an ethical duty. So doctors and other healthcare professionals are required to keep their patients' information private within the healthcare team, apart from in very specific circumstances. So just give you a quick minute to think of what any of these circumstances could be. Okay, so if you've thought of those, maybe have a think about how you would also, what you would do in those sorts of situations if you experienced them. But some of the examples are like where the patient has consented to the sharing of information. What would you do where not sharing the patient's information would put the patient in danger or others in danger? And then where the patient lacks capacity and sharing information is of overall benefit to the patient. So have a think about what you would do in any of those situations, and we will go through it in some of the role play a bit later. So next I'm going to explain Gillick competence and Fraser guidelines, which are special guidelines for under 16-year-olds who may be competent to make decisions in their own healthcare. So Gillick competence means that any under 16s must be assessed for competency to consent prior to agreeing to have an intervention. If they are deemed to be competent, then they are described as having Gillick competence. If a patient doesn't agree with their parents' decision not to treat, but has Gillick competence, then the procedure can proceed. Fraser guidelines applies to advice treatment about contraception and sexual health. The practitioner needs to satisfy the statements on the PowerPoint before these guidelines can be applied. These guidelines have been set up to protect young people, so it's important to always look out for signs of child exploitation, such as young people presenting repeatedly with STIs or having a significantly older partner. Children under the age of 13 can never consent to sexual activity and therefore should always be referred to child protection services. So if we move on to a bit of hot topics. So these are genuinely interesting to read about. So if you find any of these interesting, have a read of them and don't bog yourself down about making sure every single thing is covered. There are many, 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 as you can see, this is not an exhaustive list to look at, but it's a good idea to have a rough idea before your interviews. If you don't know any facts and one comes up, you can still use any of the medical skills that we've just gone through and the ethical skills to discuss this in an interview. So please don't worry. This can sometimes encourage you to really think about scenarios and develop a better discussion if you don't have any background knowledge of anyone else's opinions and you have to form your own. But the ideal thing is to discuss an ethical scenario completely using ethics and having a slightly greater understanding based on things you've read. Here are some ideas of some hot topics. And this would take all evening to go through absolutely all of this, which unfortunately we don't have, but please go and have a read of some of these examples and apply some of the principles that we've taught you. So, how do you answer an ethical question, a medical ethical question? So, our first step is pause, process, and think. Most often in these interviews, you'll be shown the case, scenario, or question and be given some time, so between 30 seconds to a minute, to have a think before you answer. Make sure you can utilize all of this time, first to keep yourself calm, and then to really think about the principles and apply those to the scenario in question. Summarize the key issues, so you don't have to list each of the principles and concepts, but rather pick a couple that are relevant to show the examiner that you're aware of medical ethics in general. For instance, pick 2 to 3 of what you think are the most important principles or arguments, and to avoid waffle and keep it nice and concise. So think about patient autonomy. Does it show respect for the patient and their right to make decisions? Non-maleficence, does it harm the patient? Justice, are there consequences in the wider community? And beneficence, does it benefit the patient? So give a balanced answer. And what we mean by that is show both sides of the argument. So you may be tempted to immediately choose then and there your own opinion, but that's not 100% what the examiner is looking for. So you can discuss both sides of the argument. So use language like on the one hand, and others might argue that. That brings me back to my GCSE English and arguing it that way, but just make sure that you can show and you are aware of both sides of the argument. So it's completely up to you. Sometimes you don't have to make a decision. Sometimes they specifically ask what you would do. But the most important thing of what they're asking for, it's not going to be yes, you're right or no, you're wrong. It's going to be, have they balanced up their arguments and made a decision based on the arguments that they have presented? So don't get stressed out about having to make a correct decision, because there is no such thing. Okay, what to do now? I think we're going to go on to role play stations. I don't know if Amy, you want to go through this, or if you want me to do a bit more.
Yeah, I'm happy to continue from here. So yeah, we're going to go through some role play stations now. So that's just talking in more detail and kind of applying the topics that we just went through. So don't worry, there aren't any wrong answers. We're all here to kind of give this a go. This is a tricky thing. It's not something that you probably will have done a lot of. So don't worry about not doing your best right now. It's just time to practice. So what is a role play station? So the MMI role play station is sometimes known as the MMI acting station. So different unis call it different things, but it all has the same kind of situation. So you kind of have a role that you're given and you have to act that out in a particular scenario. So you could be a doctor, you could be like a member of the public, you could be any member of the MDT, and it's just you interacting with an actor. It's normally between about 5 to 7 minutes, and some kind of ideas that it could be are delivering bad news, so telling a patient a bad diagnosis, for example, sharing an outcome, or doing something else where you'd need to show empathy. I know one example I had was I just had to help someone fill out a form in a library. It was an elderly person who wasn't used to doing that kind of thing. So it's not always going to be something medical. It's just seeing how you are interacting with people. So how should you tackle a role play station like this? So the first step, as with all of our stations, is just reading the scenario really carefully. So it sounds silly, but when you are in the MMI situation, it's a really high stress environment. You're probably not thinking fully clearly. So just taking a moment at the beginning to read through carefully will give you a really good head start. Be flexible with your communication style. So a lot of different scenarios have a lot of different ways you'd approach them. So you're going to want to speak to someone who you're breaking bad news to slightly differently than an elderly person who's a bit confused, or a younger person. So just being flexible with how you communicate. Empathy is what they're looking for here. So making sure you're being empathetic towards people. So kind of putting yourself in their shoes and seeing what it would be like for them. And that's a really good skill that you can demonstrate in these stations. Also, the joy of MMIs and the difficulty as well is that you have multiple stations, but that does mean that once it's done, you can try and put it behind you. So even if you feel that it might not have gone fully well, or there's aspects you wish you'd done better on, just try and leave it behind you afterwards. And as with all of these, we're our own worst critics. So these stations are designed to be hard at a lot of universities. So don't expect that you're going to be perfect in them, and try not to be too critical of yourself after it finishes, because you can't change it. And I imagine lots of other people will be feeling the same as you afterwards. So we want to think about who we're acting as. So are you a doctor? Are you a medical student? Are you a member of the public? What are your responsibilities as the person that you're acting as? What are you expected to be doing? Who are you speaking to? So are they a patient? Are they a family member? Are they a member of the public? So that will help you know what communication style to use. Is it a conflict? So if you are starting out in a conflict situation, say someone has been given bad news, or someone has, they're upset, they want to speak to someone to make a complaint, you're going to have to approach that differently than if you're breaking bad news, for example. So this is just another example of how we're going to adapt our communication style depending on the scenario that we've been given. And so that's just about who is in the situation and who is involved. We always want to have eye contact when we're talking to people. And in a kind of difficult communication, non-verbal cues are going to be the key to success, really. So if somebody is angry and they want to make a complaint, we want to make sure we're seated. We want to make sure our tone of voice is calm. We're not raising our voice. Our body language is non-threatening. We're trying to, de-escalate the situation with our body language. We want to have our tone of voice dependent on the situation. So if you are breaking bad news, you're going to want to have a slower, quieter tone of voice. Whereas if you are in, I say, a more, acute situation, you're going to want to have perhaps a more assertive voice. Slow and steady wins the race. So you do have, probably about 8 to 10 minutes in this station. So you're not trying to rush ahead and finish it as quickly as possible. A lot of the times you probably might not finish the situation. And if you don't finish it, that doesn't mean you failed the station. You're just trying to listen, understand, and empathize, and then come up with a solution. Just think of it as a conversation you're having with someone else. And this is something we're all good at. I imagine from your work experience, you've had a lot of, or your volunteering, you've had a lot of communications with lots of different people. So just try and recreate that in this station. And we said earlier that empathy is really important. We want to be really clear that we're being empathetic, not sympathetic. So sympathy is important. So it's useful to be sympathetic. However, sometimes it might seem a bit patronizing. Say someone's been given some really bad news and you say, oh, I'm really sorry to hear that. It doesn't always come across, that you are sorry to hear that. And maybe in that moment, it's not what the person wants to hear. So it's always better to try and be empathetic. So this is when you're trying to understand why a patient is feeling what they're feeling and what it's like to really be in their shoes. And if you can understand why someone is reacting how they are, you can understand how best to communicate with them, because you know what they're going to want to be hearing and what's going to best de-escalate the situation. So just always try and put yourself in every person's shoes, which is good advice for MMIs and also, your future life as a doctor. So let's have a look at some examples now. So let's think, for example, you've let your friend let you borrow their brand new, very expensive camera for an art project that you're doing. So say for your GCSE art. While they were out of the classroom, you accidentally dropped it. So as we can see here, it's completely smashed. And you've tried to turn it back on, but it's just broken. The screen's gone black. You now need to explain to your friend what has happened and come up with solutions to the problem. So a really uncomfortable situation. I would never ever want to be in this situation myself, but a lot of the time in an MMI, in the role play station, they're probably going to give you quite an uncomfortable situation. So don't let that, throw you. So let's have a think. Well, how would we approach this? Feel free to comment and I'll be able to see the comments. Maybe how you would start, what communication style you might need, how you could use your body language to de-escalate the situation. How would you approach this? So let's just pop some thoughts into the chat. Don't worry about getting it wrong or having to put a perfect answer, because really there is no perfect answer. We just want to pop some ideas in. So I'll give you guys a couple of minutes to have a think. So I'm not sure if there are any kind of questions in the chat. If that's fine, if not, I can kind of just go through some ideas. But I'll just leave it a couple more minutes just in case anyone's typing anything out. Okay, so let's have a think. So what could we have done? So if our friend has said to us, well, first of all, imagine that we're the friend. So how would you feel if your friend came up to you and said, this expensive camera you've lent me, maybe it was a gift, maybe you've saved up for it for ages, that they've broken it. What kind of things are you not going to want to hear? And what kind of things are you going to want to hear? Because as we can imagine, if you were that person, you're going to feel, I feel really angry. So what kind of things could we be doing to de-escalate the situation? So someone said, keep calm and be completely honest. Yep, that's a really good start. So with any situation like this, the best thing you can do is be completely honest. So you're never, ever going to improve a situation by lying. And the best thing you can do is just be honest about what's happened, because you can't change it. And they can clearly see that the camera's broken. Apologizing is always a really good place to start. So in any situation in medicine where something has gone wrong, you've made a mistake, say on the ward, or even just a situation like this, apologizing is a really good place to start. And like I said, avoid making excuses and shifting blame, because you need to make sure that when you apologize, you're doing a complete apology and taking responsibility for what's happened. And lots of really good answers here, guys. So someone said, ask things like, how does this make you feel? That's a really good place to start. So you do want to understand how they're making it feel. Perhaps a slightly better way would be saying, I can imagine this is making you feel really upset or really frustrated. So kind of getting in their shoes and mirroring back how you think they might feel to them. I like how someone said you need to talk to them as soon as they return back to the classroom. So it's always important when a mistake happens, you try to rectify it as soon as possible, be that in medicine or in an MMI situation. So sitting a friend down is a good place. So I think it's a good idea to, obviously you can't do this in an MMI, but you could talk about you want to take them somewhere to the side or privately to have the conversation. So someone said that as well, which is really good. So offer to compensate them. So yeah, it's a good idea to think about solutions, but I think in the short term, when we are having this conversation to begin with, let them take it in and kind of talk about their feelings and then talk about solutions afterwards. Because I guess sometimes if you do just offer a solution straight away, they might not feel that how they're feeling has been acknowledged by you. You're just trying to like push that to the side and solve the situation, which obviously they're still going to be upset even if you've, completely replaced the camera. So what went well? So lots of you said remain calm. Lots of you offered some solutions, so always really good. Always good to check that the friend understands. So maybe not with a camera, but in something where you've been given some really bad news, say a diagnosis or treatment hasn't gone well, something like that. You need to be making sure you're checking the understand at regular intervals. So every couple minutes, every couple sentences, just say, do you understand? Are you getting that kind of thing? And it's okay if nothing went well or you feel like you really struggle with that. It's our first situation we've gone through. So we've got lots of time to improve on this.
The main thing that you guys mentioned there, sorry, Amy, was being honest. So I've actually had this exact scenario in an interview situation, and we're going to do a role play in this situation, but you guys have done it for us. So what we meant by not a whole lot was I've had a lot of people walk in and be like, oh, your camera just fell off the desk, and like, I didn't do it. I don't know how it happened. And I've got no idea. Really sorry, but like I didn't do it. And you see what I'm doing straight away there is I'm not taking responsibility, which was the number one thing all of you guys pointed out, which is amazing. So I'm not taking any responsibility. I'm saying it just kind of fell. And obviously, when you come into these interview scenarios, you haven't broken anyone's camera. So sometimes it's a bit difficult. It's easier to be like, well, I don't know how it happened, because you don't know how it happened because it didn't happen. But the thing is that what they're telling you on the notes outside of the room is that you have broken someone's camera. So it's something that you just absolutely have to take responsibility for. And that's my number one piece of advice, is just responsibility always. And you notice how there, when I was acting out, I said, I'm sorry, but, and I'm sorry, but isn't very genuine, and it's not really owning up. There's always an excuse to follow after but. So make sure you're just saying, I apologize. I absolutely own up to what I did, and I'm really, really sorry. And then a lot of things that people can do sometimes is when they're offering a solution. Say you're talking to your friend and they say, oh, do you know what though? I haven't got any money, and I'm really worried about asking my parents for money and telling my parents that the camera's broken. So myself, as the person who's in the role play and who has broken the camera, I had people that were just listing, so well, I can buy you a new one, I can work and get a job and whatever. But if the person's that you're speaking to's main concern is speaking to their parents, and you give loads and loads and loads of solutions about getting the money, then it's not addressing their main concern. Whereas if their main concern is speaking to their parents, and you say, I will come with you to speak to your parents, and I will support you in speaking to your parents, you've then addressed their main concern in your solutions. So as Amy says, it's not about finding every single solution to this problem at all. It's about listening to what the person or the actor or the patient is saying, and responding to what they want the solution to be. Because some people will be worried about not having the money, some people will be worried about telling their parents, and they're different things. So it's about listening to what they say and responding to that, and being like, well, if you're worried about your parents, I'll come talk to your parents with you. Or if you're worried about the money, I'll get a job and I'll work really hard to get you the money. So hopefully you see what I mean there, but let me know if there's any questions about that.
Yeah, that's a really good point. And I think especially every single person presented with the same situation in the camera is going to have a slightly different thing they're worried about and a slightly different thing they're going to respond with. So always best, like as Kelly said, just to tailor your response to that individual person you're speaking to. And then someone just commented saying, should we say stuff like, I can imagine you're frustrated. So I misspoke slightly there. It's better to say stuff like, I'm seeing that this is frustrating for you. I'm seeing that this is really upsetting, because then you're just commenting on what you're seeing, and you're not really. Sometimes if you say, I can imagine, then they can say, oh, but has this happened to you? Can you imagine? So it's always best to kind of refrain from saying stuff like that. So that was me misspeaking. So just say stuff like, I'm seeing this is a lot for you to take in. I'm seeing this is really upsetting. Just commenting on what you're seeing. So what are some things that could have been improved upon if we said stuff? So we kind of commented on a lot of this already. But just stuff like unprofessional manner we should mention. So don't say stuff like, I'll buy you a drink to make it up to you. We're in an interview at the end of the day. We're not going to be talking about alcohol or anything like that. Unprofessional language, always best to avoid it. So we want to be using not really formal language, but formal language for how you would speak to a patient. Coming across as defensive, we mentioned. So don't try and make excuses, because at the end of the day, you have broken the camera. that is your responsibility and you have to own up for that. In medicine, there's something called duty of candor. So that might be something to have a read about. So that is the idea that you have the duty to come clean and be honest about things if you make mistakes. And that's really central across, being a medical student and working as a doctor. And just talking about, again, solutions don't fit the friend's actual worries. So trying to solve the money problem when they're worried about telling their parents isn't really going to come across very well.
In terms of the language, I know that that may seem like an obvious thing to not say like that sort of thing. But again, when I did this question interview, because the statement outside says you're talking to your friend, some people took that literally, and although they were talking to their mate in a room, so like, yeah, mate, sorry, I broke your camera. And like, I know that they're creating this scenario for you, and you're talking to your mate in the scenario. But please do remember that you are in an interview situation. So like mate and cool and K. As much as we probably would use that language with our mates. And if we're trying to make the scenario as realistic as possible, we would use that language. Just remember that you still are in an interview. So just to avoid those. I know that might seem like an obvious point, but people sometimes naturally change their language when they know they're talking to a mate as opposed to talking to a patient or anything like that. So just be aware of that.
Yeah, so we've kind of talked about some things that we could improve. So if we were to do this again, we would want to improve those things we just talked about. And so this is the duty of candor that we just mentioned before. So this is the idea that you have to tell someone when something has gone wrong. So this doesn't have to be the person. So say if someone, you're not able to talk to them, say they're like unconscious or, on the really bad end of things, you can't tell them, you would have to tell their carer or their family member. You also have to apologize. So that was really good, people mentioning straight away that you'd apologize, because that is key in the duty of candor. You need to offer an appropriate remedy or support. So an appropriate is the key word there. So that means a remedy to their worry. So if they're worried about telling their parents, your remedy wouldn't be buying them a new camera, it'd be going with them, as Kelly said. And that's to try and put things right. But obviously sometimes that's not possible. So if a mistake is really bad, you can't always, make it fully right. So it's important not to offer solutions that aren't appropriate. So say someone's been injured, you can't say, oh, I'll buy you a gift card, I'll make it up to you, because that's not going to remedy the situation at all. And you also need to explain fully to the person the consequences. So that's the short-term consequences. So say if someone's been given the wrong medication, are they going to have an allergic reaction? Is it going to affect their treatment if they've missed a dose of antibiotics? And then the long-term effects. So in the next 5, 10, 15 years, is there going to be a consequence as to what's happened? And then also it's important to mention, you would kind of tell a senior or tell, there's like something called Datix, which is in the hospital, you report mistakes to that. So you could mention as well that you'd report it to the necessary people. So be a senior doctor or Datix. So just kind of a recap of what we just talked about. So we're always going to want to apologize if the situation calls for it. Give them time to process. And silence is okay. So silence can be really awkward when you're in this situation. I find it really uncomfortable sometimes, sat in silence. Even with like patients, I find it quite awkward sometimes. But it's okay. If someone's been given bad news, they are going to process that a lot of the time with silence, because they have a lot of thoughts. And it's okay. And it's really, really important that you're able to sit in that silence and give them the time to speak. So if you tell the actor something and they sit there for 30 seconds, let them sit there. And then they'll speak when they're ready. And that looks really good when you do that. Be sensitive, be calm and clear, and match your non-verbals and tone of voice to the situation. So if you are breaking bad news, you want to have a quiet, tone of voice. You want to have welcoming body language. You don't want to come across as that you're not interested. And as always, listen, understand, and empathize, and then come up with a solution. So this is an example of a mark scheme we could look at. So we're going to clearly explain what's happening and check that the friend understands. Remain calm even when they're angry and hostile. So it's important that you don't escalate similarly, because that's just going to escalate the whole situation, and that's not going to be good. You're going to want to show empathy towards the friend. You can form a plan with the friend about what to do next, and then display strong communication skills. Okay, so let's put what we just learned then into example 2. So you're a junior doctor on a surgical placement, and you're just about to head into surgery when you notice that a registrar on your team has been drinking alcohol at work. So for people who don't know what a registrar is, that's just like a junior doctor, a little bit above an F1 or an F2, but you're not quite a consultant yet. So kind of like a middle grade doctor. They're about to perform a complex bowel resection. So you only have 5 minutes to talk to them about it. So what would we do? So let's have a think about applying what we just talked about to this situation and then popping what we think in the chat when we're ready. Okay, so you've got some answers coming through. So you can't be confrontational. You have to be fully sure you actually saw the doctor drinking. Patient's best interest should be at heart. Speak to them, the registrar, directly and privately. So yeah, some really good points there. So we're going to want to speak to the registrar directly. We want to speak to them privately as well. Patient's best interest should always be at the center of everything we do. So I think in this situation, we can assume that we have seen them drinking alcohol at work. I think if you are given a situation in an MMI saying you've seen them drink alcohol, probably best to kind of go with that, just because they're not trying to lead you astray, if that makes sense. But yeah, definitely in a real situation, you want to make sure you actually had seen them do it. We're going to want to keep it professional, as always, because they are our senior at work. So we said we're a junior doctor and they're a bit above us. Another person said take them to a nearby secluded area. So yeah, we definitely want to keep it in a private conversation. We're not going to want to do it in front of everyone, kind of like a public humiliation type thing. That's not what we're going to want to do at all. First of all, we want to make sure they're okay. So it's really not a typical thing to be drinking at work. I think if I saw someone do this, I'd be worried there was something going on at home or something they were bringing to work with them that meant that they were drinking at work, because it's a sign that something is really, they're really having something going on in their life, because it's not typical at all. So are they okay? Is there anything that's going on that they can talk about with you? I wouldn't go in confrontational at the start because that's not going to get you anywhere. Get to the point. So it's a really uncomfortable thing to say. No one likes to have uncomfortable conversations, and saying I've seen you drink at work is a really uncomfortable conversation to have. But you don't want to waste the whole MMI station kind of dilly-dallying around it. At the same time, you don't want to jump straight in. It's all about the balance. It's a really tricky balance to get. You must speak up. So even though they are more senior to us, we have to speak up. It could be a consultant, it could be, the CEO of the hospital. We have to speak up if we see something that compromises patient care. But as we said, we don't want to do it behind their back, and we need to warn the person that we're going to escalate it. Because whenever you have to break confidentiality, it's always good to warn someone. I really like how someone said escalate the situation and log it on the portal, because it's always good to have a record of things that's happening. I really like how this person said, don't forget to be empathetic with registrar, because that's the core of this issue, isn't it? If we approach this in an empathetic way, it's going to be a much more productive conversation than if we come at it saying, I've seen you drinking at work. How dare you? You're harming patients. If you come at them and say, I'm really concerned about you. I've just seen you, drink alcohol. Are you okay? What's going on? I'm going to have to escalate this because it's not appropriate for you to do the surgery. That's a much more productive conversation to have with someone. So some really good answers here, guys. Yeah, and speak politely, remind them of guidelines needing to be followed if you've observed drinking. So yeah, really, really good answers, guys. That's really impressive. So yeah, let's have a look at our third one. So, a couple more answers coming through. How do you start the conversation? That's a really good question. So it's a really, really uncomfortable situation to talk about, right? I think what would be a good way to do it is you kind of start off by saying, can I talk to you in a private space? Can I pull you to one side? Are you free for a chat? That kind of thing. And then you could say, look, I am concerned about you. Are you okay? Can we have a chat? Something like that. I've seen you, just before you went in, I saw you drink alcohol. Because you need to say that you've seen it, and then say, look, first of all, I am concerned about you. Talk about how they're feeling, and then maybe say, I'm glad we've had this talk. I understand you've got a lot going on in your personal life, if that is the case. And say, look, even though that is going on, I do feel that I still have to speak up, and I am going to tell the consultant, or I am going to escalate this. But in terms of starting the conversation, I think sometimes you just have to go in with it. So as soon as you're not going with it straight away, but as soon as you've checked they're okay, as soon as you've kind of said, look, I've seen this, just go out with it, because you can't say it in like a fluffy way. I think sometimes you just have to say it. I'm not sure, is that how you would approach it, Kelly? I feel like in this situation, I would just come out with it in plain language and say, look, I'm concerned. I've seen you drink alcohol. Not at the start, but after you've had a little chat. Okay, so if we've got no more questions, we're going to head on to the third example. So you are a GP and you've just diagnosed a 5-year-old with asthma. So please explain to the 5-year-old how they should use an inhaler. So this is quite a different one from the one we've just done. So it is just a communication station. So even though you're speaking to a 5-year-old and you're speaking about a medical thing, they're not assessing your knowledge of inhalers. It's not a medical exam. It's just about how you adapt your communication style. So of course you are speaking to a 5-year-old. You can't use any medical jargon or scientific jargon because they won't understand it. They're 5 years old. However, you still need to be professional. There is an examiner in the room. So you need to make sure that you aren't fully adapting your language into a really casual tone. Slow and steady wins the race, and make sure they understand each step. So they're a 5-year-old, they're going to find it quite confusing. And just as a practical tip, it will be an adult act. It won't be a 5-year-old. So bearing in mind those things, have a go at popping kind of what you would do in this station in the chat. So how would you explain this to a 5-year-old? And also maybe say how you would adapt your communication style to speak to a 5-year-old. Yeah, so someone's asked if in the scenario in the MMI, if we had like a fake inhaler or like a dummy inhaler, would that be good? So I think if you do have an inhaler in the situation, definitely good to, use that as an example to help them understand. Um, if you by dummy inhalers, you mean like a dummy and then say it's like a dummy, you have it in your mouth. I think could be good, but then I guess you don't know if a 5-year-old still uses one of those or whether they ever did. So maybe best to keep it more general. But definitely really good way of thinking about how you can speak about the inhaler in language that the 5-year-old will understand, because that's what we're trying to do in essence, really, isn't it? But definitely if they do have an inhaler on the table, use it, pick it up, show it to the examiner. Like don't just ignore it. Just see, we got a couple more coming in, but if not, we can move on. Yes, so someone's put a really good answer in. So we're going to want to speak clearly and slowly, use short sentences, and we're going to want to wait every few seconds, check the 5-year-old understands, because you don't want to give them loads of information and then they've lost you after the first sentence, because that's not helping anyone. Yeah, so that's a really good answer. So explain the basic point of the inhaler. So we want them to know it's going to make them feel better. We want them to know that it's going to help the symptoms they've been having. Because if they don't know why they have to use it, why would they use it? You wouldn't use something if someone just came up to you and told you you had to use it with no explanation. I really like the idea someone's put in about asking them to show us to confirm understanding. That's a really good idea. Because that is the best way of confirming they understand it if they can recreate it. And if you didn't have an inhaler in the station, you could just say, okay, can you tell me how you would do it then? So what have you learned from what we talked about? That kind of thing. And this could be anything. So this could be any medicine. It could be explaining to like an elderly person about how antibiotics is going to help them or something like that. It could be explaining to someone why they have to get a flu jab. It could be explaining to someone why they have to get some screening done, like a mammogram or something like that. So it doesn't have to be something, you don't have to have all the medical knowledge about it. It's just checking you can explain to someone how to do something, because that's a lot of the job of like a medical student or a doctor, is explaining to people what's happening, because people don't come into hospital with, all the medical knowledge that we might have. Okay, so let's have a look at another example quickly. I've noticed a little typo, so please excuse that. But an 89-year-old patient is diagnosed with a cancer in their lung. So this cancer is curable with chemotherapy. However, they've chosen to not go through with treatment. So their son comes in to see you, asking you to continue treating his father, and says he should be treated as it would save his life. So I should just say as a disclaimer, in this situation, the father has given you consent to talk to the son about his treatment. So what kind of things would we be thinking about, and how could we approach this situation in the MMI? So what medical ethics is related to this? So if someone's come to you and they've said, you have to treat my father, you're not saving his life. If he has his chemotherapy, he's going to live, and if he doesn't, he's going to die. Understandably, a really, really difficult situation. Like I'm sure if we were going through a situation, I mean, some of us maybe you might have experienced something like this in your personal life. It's a really emotive situation. So how could we talk about this without empathy? Discussing with the son, what would we say? So have a go at popping that in chat. And not important to speak about medical knowledge. So I've just kept it really vague with cancer in the lung, because it's not a medical station. It's not asking what type of cancer is it? What is the chemotherapy going to do? So it's not that kind of station. It's just about our communication. Yes, so autonomy is really key here. So the big question we're being asked is, should patients be allowed to refuse treatment that could save their life? And as we said earlier, they can. If they have capacity, you can refuse any treatment that can save your life. A big example of this is Jehovah Witnesses. They can, well, anyone can refuse, but Jehovah Witnesses are a big group of people that might refuse a blood transfusion. People refuse chemotherapy. It's got lots of side effects. It might not be what they want for them. People can even just refuse to take their blood pressure medication. So as long as someone said really well in the chat, as long as you have capacity to make informed decisions, you can refuse any treatment you want. And that might be really hard to look at as a doctor. If I was this doctor, I would find this really hard to understand and really hard to, not get upset by that. But it's really important we respect that our patients should be able to make their own decisions, even if we might not agree with it. And this, of course, relates to the medical pillar of autonomy. And so how would we answer in an interview? So we have some really good answers in the chat. So someone said we need to assess if the father has capacity to make informed decisions. Definitely. So how would we communicate this to the son? So we're speaking to the son here. So what kind of things could we say to the son to help him understand, what's going on and how best to explain that to him? This is kind of an example of what you could say. So you could say, I'll use the medical pillar of autonomy. Patients have the right to autonomy, which means they can make their own decisions as long as they're provided enough information to know the pros and cons. So if his father is able to understand the pros and cons, retain this information and weigh it up, this to make a decision, and then to communicate it, we have to respect that decision. So something you could say to the son might be something like, this is a really difficult situation. I'm seeing that this is really upsetting for you. And, this is a really, really difficult situation that you're in. But your father, he understands what's going on. We've given him all the information, the pros and cons. He's able to make a decision. And so we have to respect that. And say, your father has autonomy. And part of what we do as doctors or as medical students is we give people treatment, but we can only give them the treatment if they want the treatment. And so in this situation, unfortunately, your father has said he doesn't want the treatment. And, as difficult as that is, we have to respect that. And then you'd have to use, in the real thing, your empathetic language to saying, I'm seeing this is a lot for you. It says a lot for you to take in. I'm seeing that you're really upset. Using these, descriptive language. I'm not saying I can imagine what this is like. If you can't imagine what it's like, saying all that kind of good empathetic language. Yeah, really good stuff coming in chat. Yeah, ultimately we have to respect his father's choice. It's really the key sentence there, isn't it? Okay, so now kind of more calculating one. So an NHS trust is offered £1 million extra to provide a new service. So they can either use this to provide 5 babies with heart transplants who would all die without the surgery, or provide 50 elderly people with heart attack treatment. And the elderly patients would also most likely die without the treatment. So how would we answer this? So if you were to say, if the scenario was, what should they do? Should they save the 5 babies' lives or the 50 elderly people's lives? So what kind of ethical principles could we think about when answering this? And kind of how would you structure your answer? What could we say? So have a think. Oh, so that's a really good question. So someone's asked in the chat, if it's a 16-year-old refusing treatment, but their parents want to go through with it, how will it be different? So the law is different for people under 18. So if you are under 18, you can say that you want treatment. So say your parents don't want you to have your appendix out and you have appendicitis. You can say, I want to have the appendix, and you can then be consented for that. But if you're under 18, you can't refuse treatment. So in this situation, you would still go through with it if the parents consent, because they don't, then you're not able to refuse things. So it's a really confusing concept, but I guess as an overview, parents can't refuse treatment for their children if they're under 18, if the medical team deem it necessary. But if you are a child and your parents have refused a treatment for you, and then you want it, you can then have it for yourself. So you can request it, if that makes sense. I definitely read over this before your interview, because I've personally found all the legality stuff with like 16-year-olds, 15-year-old children, what happens with that, really, really tricky. Because then it's slightly different with all the contraception stuff as well. Yeah, so someone said a really good keyword. So they've said utilitarianism says we save 50 old people with the treatment. Is there a larger sample? So yeah, we could say we want to save the maximum amount of lives with this money. So we want to save 10 times the amount of lives with the 50 old people rather than saving the 5 babies. So you could look at it from a purely utilitarian or like a purely numbers view. So that is definitely one way to look at it. And definitely important to say in this kind of situation, you could answer either way. There's not a right answer. They're just kind of trying to look at how you can apply principles to a situation. So if you say 5 babies, but someone else who comes out says they said the 50 old people, doesn't mean that one of you is right and one of you is wrong and one of you is not going to get an offer. It's not that kind of situation. So one way I thought about we could look at it is QALYs. So what Kelly was talking about earlier. So we could say, I would use the medical principle of justice to think about allocating the funding to babies. So if they each live for 80 years, I can save 400 QALYs. However, if each elderly person only lives for 5 years after, you can only save 250 QALYs. So we can see from our £1 million investment, we're getting 400 QALYs versus 250. And just as a recap, a QALY is a quality adjusted life year. So it's 1 year of perfect health. So if we're saving 80 years of perfect health versus 5 years for each of the elderly people, we're going to save a lot less QALYs for the old people. And we said medical principle of justice, because justice is all about how we can fairly allocate funding to make sure nobody is disadvantaged or nobody is unfairly not able to access the treatment they need. Yeah, and someone said a really good idea. So you can also think about consequentialism. So babies would be able to live out a full life, perhaps, would have more QALYs technically. So yeah, really, really good idea. So you could say, as cruel as it sounds, so you could say it from a consequentiality point of view, the babies haven't lived their lives yet. They could live 80, 90 years, whereas it does sound mean, but if the elderly people are 80 years old, they might have less life left to live. So you are potentially saving less QALYs, less lives. It's a really difficult decision to make, isn't it? Another way you can answer it the other way is saying, I'll use the justice and the medical pillar of justice to think about this question. So I know the NHS is facing increasing pressures due to funding, and so decisions must be made as to how to prioritise this funding. Therefore, for maximum patient benefit, I'm going to prioritise 50 patients. So this is the utilitarian view. So just numbers point of view, I'm going to say 50 people versus 5 people. Because I guess you could then argue, well, those 50 babies, we don't actually know how long they are going to live. We just have to look at it from a numbers point of view in this current moment. But as long as you can use medical ethics to argue either way, then it is completely fine. What you want to avoid in this kind of situation is coming at it from quite an emotive point of view, using personal opinions. So especially stuff that is quite perhaps controversial, like assisted dying or abortion, anything like that. Don't come at it from a personal opinion. You're of course entitled to that opinion, but that is kind of trying to look at how you can use medical ethics to answer it rather than just inquiring about your opinion. And also with stuff that is quite emotional, so say end of life discussions, stuff like assisted dying, always really important to come at it from quite a sensitive point of view, and not using language that could be deemed to be insensitive by the examiner. And then one last example before we finish for today. So you are at lunch and you hear a doctor discussing a patient's HIV diagnosis, mentioning their first name and that they work locally as a lawyer. So what is the issue here? So have we broken confidentiality? So we've just said a first name. What would you do? What's the issue here? What medical ethics does this relate to? So what are your thoughts on this situation? Pop those in chat and then we'll have a talk about it in a couple of minutes. So we've got some answers coming in. So someone has correctly said, which I'm really happy to see, confidentiality is being broken. So confidentiality doesn't have to be someone's first name, last name, date of birth. Any information that is identifiable information counts as breaking confidentiality. So in this case, their first name and the fact that they work locally as a lawyer is enough to break confidentiality. Because if you lived in a local area, say it's a small town, there's only one lawyer, you're going to piece that together really quickly. Similarly, if it's like an address, a birthday, or even just like an identifiable, like the occupation piece of information, it's breaking confidentiality, especially because it's at lunch and who knows who is in the canteen. So yeah, really good that you guys picked that up. Especially with things like a HIV diagnosis. So it's always good to have an awareness of sensitive things such as HIV diagnosis, an STI diagnosis, anything that has, wrongly it has stigma attached, but it does have a stigma attached. So it's important to have a really sensitive view when you are talking patient information that could be particularly harmful if it comes out, such as HIV diagnosis. So I'm really glad that you guys picked this out. And also non-maleficence, this is harming patients. So we could say patients have a right to confidentiality. So we said that it's identifiable information, it's broken this right, and it's shared information about their care. So the only place we can share information about care is doctors who are caring and members of the MDT who are caring for the patient. And then, as you guys really correctly said, it harms the patients because they've lost their right to confidentiality, and therefore their professional reputation may be damaged. And it's just not a good example of patient care at all. And it's breaking confidentiality, which is very bad. So yeah, that is all of our slides for today. We do have time for like a little Q&A, or if anyone has any questions, please just feel free to pop them in the chat and we'll answer them as best we can. But if not, thank you so much for coming today. And thank you for the team at Primrose Kitten for having us and hosting us this afternoon, or this evening rather. So we'll be here for a couple of minutes, just keeping an eye out for any questions. Oh, so we've got a question coming. So how would you go about answering a question about a time when you've witnessed unethical behavior? Oh, that's a really good question. So if I guess the kind of situation you're thinking about, if someone has said you've seen a friend cheating or a friend asks you to sign them in for a lecture, that kind of thing. So I guess it's always really good in this situation to say that you would challenge the behavior. So it's never a good answer to say, oh, I wouldn't do anything. I wouldn't intervene. It's not my place. So you're always going to want to challenge the behavior. As like with our question earlier about you saw the doctor drinking, you're going to want to challenge that in a private place. And you're going to want to do it in a sensitive and empathetic way, kind of trying to see it from their point of view, coming at it from, their shoes. You don't want to come at it in like an accusatory way. And I guess, yeah, and then always escalating to any, relevant party, be that a teacher, your boss, another doctor in the ward, making sure you're escalating any concerns that you do have. Hopefully that kind of answers your question. And then what would be an example of a confidentiality needing to be breached if a patient had sexual contact with another person who had a sexually transmitted disease? So that's a really good question. So we said earlier, there are some situations where you can break confidentiality. And one of those is STIs. So if a patient comes to, say, a GP practice or an STI clinic, and they've been diagnosed with an STI, if they don't speak to So if they aren't going to tell their partner and you can't persuade them to tell their partner, you then are allowed to tell their partner. You don't like ring them up. It's like an anonymous form they send the partner. But in that situation, you are allowed to breach confidentiality. But really important in any situation where you have to. So another example could be if someone is going to harm themselves, or they're at risk of suicide, or they're going to harm someone else. You have to tell them before you're going to break confidentiality that you're going to do that. So you could say, look, I'm really concerned about this. I am going to have to tell someone else about this. This is who I'm going to tell, and this is why I'm going to tell them. But you do still have to say you will break confidentiality for that.
I've just seen a question on there about for questions like abortion and euthanasia, there are for and against arguments. If they ask for your opinion directly, how should you go about it? What if you have completely different opinion from the interviewer? So as we mentioned earlier in the talk, it doesn't matter what the interviewer's opinion is, and they won't make it clear what their opinion is. All that matters is that you can argue both sides. So if they ask you for a decision, end up on one side, but make the interviewer aware that you can demonstrate the arguments of both sides. So do the arguments for, do the arguments against, and then make your decision. Don't worry about having a completely different opinion from the interviewer, because that doesn't matter. They're not judging you on what your opinion is. They're judging you on how you can decipher and weigh up an ethical argument.
And it's probably going to be unlikely to say it was about an abortion. The situation would probably be more like a patient that's come to you to talk about something. So it's kind of the situation where you're never actually going to be sharing your opinion with the patient as a doctor. They just want you to see that you can see both sides of the argument, if that makes sense.
And then there's one about having props on the table. Could you use it properly to demonstrate? Is there a risk of the inhaler being unsanitary? So this one, they first of all, it won't be a working inhaler because that would be really dangerous. And second of all, yeah, I wouldn't like put it to your lips and use it as you would a normal inhaler. But there will be cleaning equipment there, but it won't be a working inhaler, so don't worry about that. But if you can very, very easily demonstrate just holding it up to your lips. You don't need to put it on your lips or anything like that. And if that's something that you were going to do, you would absolutely need to clean it and have all the equipment there, which I doubt would be in that scenario. So just make sure that you don't actually put it to your lips, and it won't be a working inhaler, so don't worry about that.
So someone's asked how to break bad news in an empathetic way. So I'd recommend having a look at the SPIKES acronym online. So that's setting, perception, invitation, knowledge, empathize, and then summarize. So it's a good way to structure your answer. So just have a look. So it's just like having them in a private area, making sure they are able to talk, understanding what their current viewpoint is. So what do they think is happening at the moment? Do they think that's going to be bad news? Do they think it's going to be okay? Kind of giving them a warning shot. So saying, I have something really upsetting to tell you. Do you have someone with you? Giving them the information, but not overloading them. So just giving it, the key bullet points, then empathizing. So saying, I'm seeing this is a lot for you to take in, something like that. Saying, I'm seeing this is really upsetting. And then summarizing at the end, making sure they've understood. So have a look at the SPIKES mnemonic. That's a really, really good one. So what is the chance of a hot topic coming up, which isn't a big topic? So I would say probably quite small. I think they want you to succeed. They want you to, do your best. So I think asking something that's really niche isn't, from my point of view, something they would do. But I think it is important just to keep an eye on the news, like the BMJ Student Medic Portal has lots of pages on hot topics, just because if you aren't, looking at stuff, it might feel niche, but it could be quite a popular thing or quite a new story. So always good to have an eye out on the news stories that are breaking. And if you've never heard of the topic, just try and apply the medical principles to the situation. So they'll give you enough information that if you haven't, they won't just say talk about this case, from my experience anyway. And if they do give you a brief summary, you can just apply the medical ethics principles to it. So if you answer a question about which healthcare professional is more important in an MDT, first of all, I think in interview, I would never suggest saying any MDT member is more important than anyone else. So we all have different roles to play, and no role is more important than any other role, because they're all just different and they all complement each other. If you are talking about comparing the role of like a nurse or a doctor or a PA and a doctor, really important that you don't criticize the other role. I know there's lots of stuff in the news right now about PAs, stuff, rightly or wrongly, people have quite strong opinions on it. But as before, they're not asking about your opinion. They want you to say a doctor has more of a leadership role, a doctor can independently prescribe, a doctor can specialize further, doctors have a wider preclinical knowledge base, stuff like that. Not asking you to say your opinion on, whether PA should be regulated, that kind of thing. I'm not entirely sure about eugenic style questions. I'm not sure that's something I've really read up much on. I would just say with any kind of ethical situation scenario they give you, just try and relate it back to the key principles and avoid, kind of emotive phrases or, really strong personal opinions, is a good bet for any kind of situation like that. So I guess eugenics would be like screening in pregnancy, like aborting, like after like Down syndrome screening, stuff like that. So I guess you'd just be looking at autonomy. People have the right if they have all the information. You could argue, is it going to be more harmful if that baby's born? Stuff like that. But I personally haven't read much about that myself. I'm sorry.
There's a question about the spike structure. Can you elaborate more on the invitation part when practicing a scenario? It felt very unnatural to ask how much a patient wants to know. So how would you go about it? First of all, with the spikes thing, I'm a fourth year medic at Manchester, and that's something I'm just learning about now. So the likelihood of you having to break bad news in an interview and use the spikes model is quite low. Obviously, anything's up for grabs, but they're not going to be assessing your use of the spikes model in an interview situation because it's not something they've taught you yet. And as a fourth year medic, it's only something that they are just teaching me now. So I wouldn't get too bogged down about that. It's just a nice a thing to have in your plethora of knowledge to fall back on should they ask you about that, but please don't get too bogged down about it. And it's unnatural to ask how a patient wants to know. So how would you go about it? How they've taught us recently is just to say, what do you know of the situation so far? Would you like me to discuss the results, or would you just like me to discuss this with you? And that's how you go about it. So you kind of check their previous knowledge, and then you say, I've got the results with me, or I've got X and Y and Z with me. Would you like me to discuss this? Would you need somebody else? Would you like somebody else in the room? Would you like to call someone? And that's how you kind of go about it. But please don't get too bogged down about that.
Yeah, it's more just kind of a thing to have in the back of your mind. You won't be assessed on. And I think, to be honest, a Breaking Bad news station at MMI would be really, really mean. I think, especially with like a cancer diagnosis or anything like that, that's kind of stuff we have in, like as Kelly said, our fourth year exams, our fifth year exams. So it would be very mean to give you that. So when the topic of an MMI station is unheard of, what key points should be researched first? I'm not sure I entirely understand the question. I guess, I mean, if you don't understand the station when you're in there, always best to, take a breather, read the question again, see if there's anything you do understand, ask the examiner for any clarifying questions. Obviously, they can't give you the answer, but if there's something you don't understand in the question itself, you could ask that. Yeah, I'm not entirely sure I understand that question, sorry. But yeah, I think that's all the questions we're going to do today. We do have a form for like any other questions, so we'll share that. But yeah, thank you for coming, everyone. And hopefully that was really helpful for you guys.
Thanks, guys.
Thank you so much, Amy and Kelly. That was amazing. That was so insightful. And thanks everyone for all your amazing questions. We have one left in the series now. So the Medics Me team will be doing an interview Q&A on the 17th of December, which is in 3 weeks' time at 7 p.m. Okay, so it's the same time. So it'd be a good idea maybe to watch back the last 3 and just come with all your questions, and the guys will be able to help you with anything that you want to know about, basically, which would be amazing. So please do join us in 3 weeks' time for that one. I will post the link that the guys are going to send now for any more questions. I'll post that in the comments. But yeah, hopefully we'll see you in 3 weeks' time. Thank you, everybody, very much.